Well, the CDC says norovirus cases are rising. December marked the highest level of norovirus outbreaks since 2012.
Now, for more on the virus and what precautions we can take, we're joined by our good friend, Dr. Timothy Quinn, Quinn Healthcare in Ridgeland. Thank you for being with us today, Dr. Quinn.
Hey, thank you for having me.
First question, what is the norovirus?
The norovirus is a virus, but it's an illness that's considered foodborne. It's passed by direct contact of someone that may have it, that may touch a counter and you touch the counter, or you may shake hands, or they bite something and then you eat after them. It's spread by direct contact, not the respiratory droplets like the other viruses. But the deal is, it's very prevalent right now, and it causes a lot of discomfort in regard to stomach pain for many, a lot of people, diarrhea, nausea, and vomiting, and you can get dehydrated.
Dr. Quinn, what's behind the spikes of norovirus this season?
Well, we really don't know right now, but we think back to COVID, where viruses do mutate. And sometimes they can mutate to become more virulent, meaning that they're more easily to catch from one person to another, something a little bit different about them. So there may be a mutation, is not yet known, but there's also the fact that it's been a little bit colder and people are congregating indoors more close together, more susceptible to spreading the virus from one to another instead of being outside spread out where the weather is warmer.
A lot of people tell me they've had like a stomach flu or something like that. So what precautions can we take to protect ourselves from this norovirus?
Should people be wearing masks again?
Or gloves?
Not necessarily for the norovirus, but just be noted that if you do contract the norovirus and you are someone that's susceptible to contracting the flu or COVID or RSV, which are the other big viruses out there, your immune system would typically be a little bit more compromised. So during this time of all this spread of all these different viruses, if you're going somewhere and there's a great deal of people that are going to be there indoors and you're someone that's potentially immunocompromised, say you're someone that's older or have many chronic medical conditions, I would consider wearing the mask again, just to better protect yourself. Because at the end of the day, you want to be as safe as you possibly can.
One more question from me, Dr. Quinn. How do you tell the difference between the norovirus and other viruses like the flu or COVID? I mean, you know, sometimes you'll say, well, I've got the flu, I just got to rest and you know, take some Advil and drink lots of fluids. How would you know that maybe you need something else? Or can you get something else for it?
Well, the deal with norovirus is there's no direct treatment. The best thing is hydration and rest to make sure you don't get dehydrated. But also note that if you're very sick, usually the norovirus doesn't have the typical upper respiratory tract symptoms like the runny nose or the cough or the sore throat, like the COVID or the flu or the RSV. But the best thing to do is when you really feel bad, go visit your medical provider to get tested. And then that way we'll test for COVID, flu, some test for RSV, but the norovirus is a diagnosis of exclusion, meaning we tested for everything and you had all the symptoms, but you tested negative for COVID and the flu and RSV, and now we'll give you that diagnosis with the advice on how to stay safe.